Now let's examine the electrocardiogram, which is abbreviated as ECG or sometimes EKG. The electrocardiogram is a graph of the electrical activity that's happening in the heart, and it is a very important clinical tool that is used for looking for normal function of the heart and then diagnosing improper function of the heart. The image at the top shows a trace of what the electrocardiogram looks like. You can see that there are 3 heartbeats on this particular trace. There are typically 5 waves that we look for on the EKG. The first wave is called the P wave, and that is a small bump right before that large spike. And this represents the depolarization of the atria. The next wave that's important is called the QRS complex. This is technically 3 waves that are so close together we look at them all as one. During the QRS complex, we see the depolarization of the ventricles. So this is when the ventricles will be contracting, and then the repolarization of the atria. The repolarization of the atria is a much smaller electrical signal and isn't seen on the EKG. And then the last wave of the heartbeat is the T wave. The T wave is the repolarization of the ventricles. Notice how when depolarization or repolarization happen, the waves tend to go up. So the direction of the wave on the EKG does not correlate to the actual membrane potential. Between the waves, we have several intervals and segments that are useful in diagnostics. So the first is called the RR interval. So this goes from one R peak to the next R peak, and this is the interval for an entire heartbeat. So this is the entire generation and duration of the action potential as it moves throughout the heart. A faster heartbeat will show a shorter RR interval. Another interval of interest is called the PR interval. So this is going to include the P wave and the segment until R. So this indicates from when the action potential is started by the SA node, which is when the P wave starts, all the way until it travels to the ventricle. So this is going to stop right before the ventricle depolarizes. So this is going to actually show that delay in the movement of the SA node to the AV bundle. Another interval of interest is the QT interval. The QT interval is the entire electrical activity of the ventricles. So the QRS complex, then a short segment, and then the T wave. So that is going to be the depolarization followed by the repolarization of the ventricles. So that's the whole contraction and then relaxation of the ventricle. The last portion here is called a segment because it doesn't include a wave, and this is called the ST segment. So this is from the S wave at the end of the depolarization of the ventricle until the beginning of the T wave. So this ST segment is only a flat segment. There's no electrical change occurring. And the reason for that is because it is showing the plateau phase of the ventricles. So this is between the depolarizing and the repolarizing. The graphic trace of the EKG can show us dysrhythmias. So a dysrhythmia, or sometimes called arrhythmia, but dysrhythmia is the more correct term, is a disturbance in the electrical rhythm of the heart. Broadly, dysrhythmias can be put into different categories. EKG is going to be able to tell us what the heart rate is because we can see how many beats there are per minute. The term bradycardia is given to a trace that shows less than 60 beats per minute. So this heart would be pumping abnormally slow. Maybe the SA node is not pacing correctly. And then tachycardia is going to be when the heart is beating faster than 100 beats per minute. So a tachycard is beating very quickly. The graph shown here is called sinus tachycardia. Sinus meaning that it is a normal rhythm. Each of the heartbeats shows a P wave, a QRS complex, and then a T wave. And so the sinus rhythm is normal. However, it is just happening rapidly. So it looks like this heart is beating correctly, just quickly. An EKG can also indicate problems in the conduction pathway. So these are often called heart block because there is an issue with the pacemakers sending information throughout the heart. So in this case, the EKG trace shows a heart block happening somewhere between the sinoatrial node and the AV node. The SA node, if you remember, is faster, about 60 to 70 beats per minute. The SA node is going to be in the atria, and it's going to cause the atria to depolarize, which is going to give us P waves. So in the graph, we see 6 P waves. However, the SA node is not transmitting to the AV node. If it was, then every P wave would have a QRS complex. That's not what's occurring in this trace. The AV node, as you remember, can pace on its own, and it paces a little bit slower at maybe 40 to 50 beats per minute. And so what's happening here is the P waves and the QRS waves are decoupled, and the QRS complex, which is the ventricle contraction, followed by the T wave, is only happening when the AV node fires. And so we're getting only 3 QRS complexes, even though there are 6 P waves. Another type of dysrhythmia that can be seen on an EKG is called fibrillation. So fibrillation happens when some regions of a chamber depolarize while others are repolarizing. Essentially, the whole chamber, the atria or the ventricle, is not contracting altogether. Atrial fibrillation is not immediately life-threatening. You can see that the atrial fibrillation, the P wave is not present. There are regions where it is pretty irregular between the QRS waves, and there's no distinct P waves. However, the QRS complexes are very distinct and regular. This means that the ventricle is firing and that it's able to pump blood out of the heart. The atria doesn't have to contract as a single unit in order to pump blood into the ventricle. So even while the atria is fibrillating, blood can still get into the ventricle. The second image is ventricular fibrillation, and ventricular fibrillation is immediately life-threatening. This is something that needs to be addressed as an emergency. It is often done by using a defibrillator. So defibrillation is the act of applying electrical shock to the heart. You may have seen this in TV shows or emergency shows. Hospitals have defibrillators, and public buildings all have defibrillators. And the reason that this is problematic is because the ventricle is contracting in some regions and not others. So there is no coordinated contraction of the ventricle, which means there is no coordinated effort to pump blood out of the heart. Ventricular fibrillation will cause lack of blood flow throughout the body and then eventually death if not corrected.